All right, welcoming into Social Distillation, the submarine still of the internet, where we attempt to drop the bead and pour white lightning straight onto your brain. What are we talking about today, Samu?
Well, we're on a health and fitness episode, which is our lane. So hopefully you get something out of this. And we're going to talk the new weight loss drugs, new as last several years, the new magic pill. And it was something that irritated me because of something I saw on a drive. And you kind of want to go into the social aspects of it too. But we have to give a disclaimer here because we're not your trainers. We're not working with you personally. This is for educational purposes only. We're not your doctor. If you are a candidate and we're going to go over the good and bad of these things. So if you're a candidate where it is good for you, listen to your doctor, go with that. And just this will actually help you be more informed when you're talking to your doctor. So there's the benefit there for you.
And what triggered this was, and I've seen this before, but I don't even remember which one of these drugs it was, but there was a Super Bowl commercial for this, not just a Super Bowl commercial, which is already really expensive, but their spokesperson was one of the Williams
I
sisters,
think it was
who
Serena. Yeah.
who's talking about how much weight she has lost using it and how much better she feels because of it. And I don't remember who it was who started this, but there was this kind of mini war on X of people saying that never happened because somebody had posted, "Isn't it amazing how quickly the body positivity slash fat shaming movement disappeared as soon as Big Pharma discovered they had a magic pill they could sell you to get rid of the fat?"
Hmm.
And all there were all these people coming out of the woodwork on the wokey side saying that never happened, and pff, here are the receipts, tons of them, tons of screenshots, articles, covers on magazines, the freaking Sports Illustrated swimsuit edition. Is no, no, no. We're not allowed to fat shame. You have to be body positive and completely ignore. I mean, for crying out loud, the other I just thought of this. The other whiplash part of this is for 8 years as first lady, what was Michelle Obama's thing? It was making school lunches healthier to address the childhood obesity epidemic in America, but it's spread to the West in general now, the industrialized world in general. Why? Because that's incredibly unhealthy. Okay. And then all of a sudden, no, 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 that's fat shaming. That's mean. You can't do that. It is not, you can make it mean, but it is not mean. It is simply factual to say if you are overweight, you are unhealthy. If you are in the obese category, you are dangerously unhealthy.
Hmm.
And correct me if I'm wrong, or expand if you want on the technical side of this, but the best explanation I have heard for how to explain why being overweight is bad for you is that it essentially puts your body in a systemic low grade inflammation
Hmm.
constantly. Oh,
Yeah, at a certain point of obesity, basically your fat in general, your fat cells, but all as a collective, become an autoimmune inflammatory body. It becomes its own organ basically for producing inflammation. And then
mhm.
combine that with just the gravitational effects on your joints and which is, being overweight and obese. Okay, so we have to parse words here. So from a professional level, overweight is your BMI, is your weight to height ratio. Your obesity is your body fat percentage. Now we conflate those by saying obese when your BMI is so high, but that's at a point where it's high enough that it can't naturally be that height to weight ratio without it being fat, pretty much, which is, you know, potato, potato. BMI is a great population measure, not a good individual measure because I am borderline. I am overweight, borderline obese by BMI, but obviously I'm not fat, right? So athletes tend to be
Strongman competitors, defensive
Yeah,
linemen, you know.
yeah.
Yeah.
Well, I mean, your running back. Your running back is 5'10", 210 pounds. That's obese.
Hmm.
But look at him; he's probably about 8% body fat. So so obesity is actually the amount of fat you have on your body, where overweight is just a height to weight ratio.
Yep.
So when I say obese, I'm talking about fat, and that I needed to clarify that because there's a thing called we call skinny fat too, and anorexic people are obese because their fat to muscle ratio is not good because they have no muscle. They're basically bones and skin, which skin counts towards your fat, your subcutaneous fat tissue. So we do want to parse those out. Now, what got me on this is you were talking about the social aspect of it. Well, it's Hollywood, right?
Hmm.
Hollywood is driving this. What the entertainment industry, Hollywood and the music industry is driving this. And to me, that's no surprise because we also had back in the day the steroid shaming, right? If you were doing illicit drugs to help with your physique, you were cheating, right? And my favorite example of this is this fellow right here. Great actor. This is Christian Bale for those of all that are just listening. Uh, 2002 American Psycho. He was 81 kilograms. That's probably a pretty good lean body right there
Hmm.
for his bone structure. Reign of Fire, 83 kilograms. So that could be perfectly natural.
Came out in the same year.
Came out in the same year, but
Hmm.
it's only four and about 5 pounds of muscle.
Hmm.
That can be done in 3 months naturally if you're doing the right things. But you could also see he's also got a little bit more body fat there. I could blow this up here. So he's got a little bit more body fat in that picture as well. So that one can be believable. Now we get to the machinist. And from what I understand, I think he ate an apple and a can of tuna a day for like a year
Yep.
to get down to that weight. He's 55 kilos, so we're talking 2.2, 120 something pounds. And on his frame, for those that can see it, you see how bad that is.
Yeah, I think he's like 5'11-ish in height. That is really, really sad. I mean, he looks like very similar to down on the other one, Rescue Dawn, where he actually plays a POW. He looks like, a picture you would see of an abused POW. That's how skeletal he is.
Hmm. And so look at the lack of muscle mass on his body there. He is as lean as can be. You can see every bit of muscle on him, and they ain't much there. Okay, so now this is the one. 2004 to 2005, he went from the machinist to Batman.
Hmm.
86 kilograms, and look at the size of his arms, shoulders, chest, everything. Now he's got a little bit more body fat there than when he was in the machinist, but he's still pretty damn lean. I would call him about 10 to 12% body fat
Hmm.
in that picture, just eyeballing it. I mean, the veins are still popping. That's 30 kilos, not 30 pounds, 30 kilos of mass. And when you're fluctuating mass like that, some of it's fat, but you can tell most of it's muscle, and natural gain is about a half a pound a week if you're doing everything right. So 30 kilos, we got 2.2, 66 pounds of muscle he put on, or 66 pounds of weight, and a lot of
Hmm.
it muscle he put on in a year. Yeah, your bodybuilders would be envious of this, and they're on gear meaning the steroids. So then he's back down to 60, so he lost 26 kilos again, almost 30 kilos. And you said, like you said, he's playing a POW, and that is again 1 year. Extreme diets. He probably was using something like HCG to keep from dying while he did an extreme diet there. So again, we're talking unnatural amounts of fluctuation. Then he's up another 27 kilos for Batman again. Then back down 20 something kilos for the fighter, which what was the fighter about? I've never seen that.
I believe he was a former fighter or trainer who had become a heroin addict and was like
Mm.
trying to help his brother. I don't remember who his co-star was, um, to get back into boxing or something like that.
And then it looks like he got fat for a role, which I mean, actors do that.
Yep.
That's part of their
Very
job.
fat though.
Yeah. So
Yeah.
40 something kilos, and that looks like a lot of fat. So that's just eating a lot right there. That's purposefully eating. That you're probably downing just sugar water to get that fat.
Hmm.
So, but this is not something new in the entertainment industry. And we have to look at that as a population and say, oh, okay, well, that's their part of their job. And just like athletes, they do things that are unhealthy for themselves to get these roles, to do these jobs. I think it was Tom Hanks that got really fat for a role at one time, and it was all belly fat because he had that big old round belly. Uh,
And
but
then lost it for Castaway.
mhm.
Yeah. Is he was just, yeah, I can't remember what it was, but it was similar to the Christian Bale diet of an apple and some tuna. It was like oatmeal and canned tuna and not very much of it to very quickly lose that weight for Castaway.
But the new phenomenon we have now is see these famous people doing these things to continue. I mean, you got to be, it pays to be pretty in Hollywood, okay? So if you're gaining weight, unless you're that funny fat person in the movie, if you're gaining weight and you're a sex symbol, you're probably gonna do something to keep that status longer. And that includes, you can pay the doctors, you can get the right doctor, you can doctor shop to get the things you need. And as the public, we have to say, oh, that's what they do. They're sacrificing the future for this thing. Now, if I do it, would I be sacrificing my future as well? Would I be doing
Mm.
something unhealthy? And that's where we got to the next part of this, because that's where these billboards come in. Wegovy, weekly weight loss injections. Is that person in that ad overweight or obese or even fat in general? No.
That is a pretty fit person.
She looks like an
Yeah.
off-season fitness model.
Hmm.
Like she's in the off-season, she's not ready for stage, but she's working out. That's what she looks like. Next one, Wegovy pill, the new oral option for medical weight loss. Medical weight loss? Did this lady in this ad need medical weight loss?
Nope.
No, she's actually probably
If
underweight,
Yeah, I was
if
about to
anything.
say, if anything, she needs to put on some muscle mass.
Yeah, and going down the road, she's still rubber and magic in her 20s in this ad,
Hmm.
but we're talking bone mass and osteoporosis later in life, sarcopenia later in life. 6 month Wegovy semaglutide weight loss results. Do we really believe that that fat belly
That
that they didn't
model
show
looks
a
like she's
face?
15 for crying out loud.
Yeah, and do we really think that I think it's on purpose they don't show the face of the fat
Exactly.
belly because it's not the same person.
So yeah, if you're just listening, this one I think is the worst because up in the
It's
left,
implying she lost the weight. Yeah.
exactly, up in the
Yeah.
left, you have a picture that is just the belly where you're injecting this substance into the belly fat. And then down on the left, filling up the right side of the screen, is a very thin, very young model with a tape measure around her barely existent waist.
hmm This one is the cherry on top.
Hmm.
Lose weight with lap band. This is a billboard. I don't know where this billboard is. Credit Getty Images. Uh, Glenn Koenig is apparently the photographer. So there's your shout out on this channel. Nobody watches. But lose weight with the lap band. 1-800 get thin. On the billboard is a very, very, very normal weight person that has obviously never been fat. I mean, if she was obese enough to need the lap band,
You would
that
see
back
it
of
in
the
her
arm,
tricep.
yeah, that
Hmm.
back of the arm would be hanging down like a little flop.
Yep. Which the So I'm glad you actually found this one instead of the one you were looking for, because one of the points I wanted to make is there have been a number of stories as these I can't remember what the classification of this drug is, what they call this group of drugs, but as they've risen in popularity, there has now already been a number of stories out about rebound, about people
Mhm.
who go off it and then very quickly regain all the weight. And it made me wonder again, I was already wondering this, and then you pointed out you have seen billboards in your area advertising these drugs as not what they were originally designed for, which was
Type 2 diabetes.
type
Yeah.
2 diabetes, morbidly obese. You
It
have to
wasn't even
lose weight
designed for
now.
morbidly obese people. It was designed for
Oh,
the
I
type
didn't know it was
2 diabetes.
specifically that. Okay.
But
But
they found in their trials that these most people that are type 2 diabetic are obese, that
right.
they were losing a lot of weight as well. So then it
Mhm.
became kind of off label. And then they actually started studying it in obese people. So I have a lot of studies in obese people, which it might be a great population for this.
Well,
But
I had heard from people when lap band was becoming popular after Al Roker did it, and he was kind of one of the first big celebrities that was very obviously lost a ton of weight and was, open about this is how I did it. And I had several people who I knew who were looking at it, and the doctor told them, I will not do this until you get on a healthier regimen because they already knew if you keep the same eating habits, you will burst the lap band, which is bad.
mhm.
That is very bad. And
Well, and what a
so,
lot of people figure out is they learn how to graze,
mm,
where you're not eating a lot at once, but you're just constantly eating.
yes.
Yeah.
So at least the doctors these people were talking to were doing it properly of okay, this will help jumpstart you into being healthier. We've got to take the pressure off your joints. We've got to cut down that inflammation that is stressing your body. As you say, it's akin to an autoimmune disorder. And that is very stressful for your body. So you need to get healthy quick, but we need to see a change in lifestyle to make sure that post surgery, you actually have the success one, the success you want, the success we're going for when it comes to getting healthier. But two, and probably more importantly, considering lap band surgery, is so you don't ruin the surgery and put yourself in either even greater harm.
Hmm.
Okay. I don't know if those conversations are going on. And judging by the advertising that's happening, at least, the advertisers clearly don't give a damn about the rebound effect.
Yeah, and just to bring the literature in to what you're saying here, it took me 2 seconds to find this. Metabolic rebound after GLP-1 receptor agonist discontinuation, a systematic review and meta-analysis. So, meta-analysis, again, for the reminder, is a collection of randomized controlled trials
Mhm.
put together to basically put the big picture together. This is by Tsang and colleagues, uh, and just highlighted here greater weight regain with longer follow-ups and with the semaglutide compared to basically a placebo liraglutide. Semaglutide also led to greater increases in waist circumference after they got off of it. So, according to all of these studies that they gathered together in this meta, yeah, there's a rebound. There's definitely a rebound effect. What the mechanism of it
Mhm.
is, they were unsure. The mechanism still unsure. Is it that so it's a receptor agonist, which means it attaches to the receptor that normally the thing you make in your body naturally would attach to. And that causes the receptor to be active. So whatever, so when we think of this is it's slightly different than this, but it'll be more clear with insulin. Your cells have insulin receptors on them. Okay, so a cell wall, we talked about cholesterol, is mostly made of cholesterol, which if you look at something, we talk about fat soluble and water soluble, things don't permeate fat soluble barriers very well. Your skin is one. That's why when you buy your vitamin lotions, they're in a fatty substance, which is the lotion itself. That's why it's so greasy, because that allows the vitamins to permeate your skin because it opens up the barrier. So your skin is a barrier that is susceptible to fats, not water. That's why when you get in a pool, you don't blow up. because of the diffusion of the water in your body versus the
Yeah.
water. The pressure of the water in the pool would be greater than the pressure of the water in your body. And if you weren't uh, if you didn't have a barrier, a border, so to speak, against H2O, you would just blow up to the pressure of the pool, which, I mean, that much water, how much, you got a 50,000 gallon pool. That's a lot of pressure based on the weight of the water, the density of the water. So you would blow up every time you got in water if it wasn't a barrier against water, but it is not as good a barrier against fat. So the vitamins are in fat. You put the lotion on and you absorb the vitamin E, the magnesium, any fat soluble vitamin or mineral that's in there. So the same thing happens in your cells. And so a sugar, which is water soluble, is going through your bloodstream. So it would be glycogen at that point, converted to glycogen, and it's water soluble. There's a receptor on the cell that insulin attaches to, and it opens up a door, and that glucose can go into the cell. So insulin is an insulin receptor agonist. So it hits it, it opens the door, allows the thing to happen. Semaglutide, which is GLP-1s, they're an agonist to a similar process, which lowers your blood sugar, helps you do all kinds of things. We'll get to the mechanisms further later, which I think is the main reason it works. But it allows that to happen. But what have we talked about with our SSRI discussions, our cocaine discussions? When you have an outside source providing that agonist action, your body stops making the thing that would normally do it. And that's the fear here, and that's the long-term thing we don't know, but it is suggested in the study I just brought up, plus any studies that are followed up. But we're so new into this. I mean, they said the longer the follow-up, the worse it was, right? So when did these come out? 2001, somewhere around there? Like became mainstream at
I
least.
didn't know they were that old.
It, it,
I didn't start hearing about them until 5 or 6 years ago is when I started hearing
well,
about them. So I didn't know
2001
they were
was
that old.
2001 was 2021. Excuse me.
2021.
I meant to say
Okay.
21. Sorry,
Yeah.
I apologize. My mistake.
2001 was when lap band was getting going.
Yeah.
So
So
that's
lab band's different because it's a mechanical thing. It just
mhm.
makes it to where you can't fit stuff in your belly. But an actual receptor agonist, if it works in the way where your body stops making its own, then as soon as you get off of it, those doors are closed because there's nothing to open the door. It's like taking the door handle off the door and locking it. There's nothing there. You're gonna walk up and you get what are you going to do? Kick the door down? It's not there anymore. And you would have to go through a process of your body relearning to make this hormone that normally would do that job. And that's what we don't know. Is it one of those things that does that? Is it like dopamine, uh, the dopamine agonist in cocaine, where you stop making your own dopamine and you need more and more cocaine, and as soon as you get off of it, you go through withdrawals.
But
And
eventually once you work your way through those withdrawals, which, is there is a reason there are rehabilitation clinics
mhm.
because if it's bad enough, you need medical help to get through it without dying, literally dying.
Yeah, yeah, not to downplay it, but cocaine withdrawals are more of a just you're depressed.
I meant the
Alcohol
withdrawal in
withdrawals.
general.
Yeah.
It can be very, very taxing on the body because
Mhm.
of the mechanisms you're describing. And so,
So do we have GLP-1 withdrawals, which the effect of the withdrawal is usually the reverse of the drug, right? So if you lose weight rapidly, do you gain weight rapidly? Well, the studies suggest maybe.
mhm. But now there's another problem that is I don't know if this link has been shown definitively. You have the literature up, but the other problem that I had heard about the side effects of this, but I hadn't thought about the mechanism of it until you went off on a rant when I brought it up about like any drug, this drug is systemic. It is not just targeting just the thing you want. Do you have your
Mhm.
prop handy of your antibiotics? of
It's not an antibiotic. It's a anti-inflammatory.
anti-inflammatory. Okay, so
Yeah.
like anti-inflammatories and antibiotics, they are good when you need them for something that your body can't handle on its own. They are bad long term because they don't discriminate. And as most people now know, that I mean, I remember when I first learned of, wait, there's bacteria living in my large intestine. Yeah, and it's good. Your body needs it. It's bad if it gets out of your large intestine. That's sepsis,
Hmm.
but
Yeah,
your
as we
body
know.
needs that.
Yeah.
If you are on strong antibiotics for too long, you will start to have GI problems because you're the antibiotics are killing that bacteria along with the other bacteria that you need to get rid of. Now, sometimes that's necessary. I've brought up before poor Alex Smith, who got the flesh-eating bacteria when he broke his leg on the field and got, some, you know, something funky got in there in that wound because it was such a bad break, and it was literally eating his body. He had to go through very, very intense, strong regimens of IV antibiotics and surgeries to try and get rid of it. So, yeah, obviously you're not going to go, I don't know, that might make my tummy feel bad when your doctor is literally contemplating amputating your leg, right?
Hmm.
So there are obviously times where you need this, but on the other hand, there's always going to be side effects.
Hmm. And
And
I have my prop. This is a commonly prescribed, again, listen to your doctor, disclaimers, blah, blah, blah. Uh, not antibiotics, you kept me on that track. Uh, uh, Anti-inflammatory. So I have a couple of these because I had dental work done. This is not a real tooth right here, because it was knocked out when I was 13 years old and the crown was finally too much, so I had to have an implant. So they were prescribing this to me every time I went in, and it was 6 procedures to get the implant done. I started refusing it, but I have 2 boxes of it. And you do a run for 21 days, and it's an anti-inflammatory in case your gums get flared up because of the work they did. In case your gums get a little bit achy from the work they did. That's your trade-off. That's your okay. So we're looking at cost benefit analysis, right? So my gums might get a little inflamed, be a little achy. Okay. The flip side of it, side effects include tendonitis, tendon rupture, especially the Achilles tendon, because it's a systemic anti-inflammatory that attacks the connective tissue. Because the thing people don't realize about anti-inflammatories, where we saw it in baseball a while ago when they get the cortisone shot and then they go out and try to pitch and throw their shoulder out. Because yeah, it takes care of all the inflamed tissue, but it doesn't know what's good and bad. It's a freaking chemical. It has no brain. It goes in there and it just takes everything out, including the inflammation. So we don't know what the long term effects of using those over and over again is. One of the things about physical aging is oxidation of the connective tissue. Basically, take a rag, leave it out in the sun for 3 months, and then grab it and pull on it. What happens to it? It rips apart. So we're constantly, as we age, doing that in our body. That's why antioxidants are a thing. Oxygen is the chemical in the world that is slowly killing us day by day, but we need it. It's just like women. It's and no, no, but that's what's happening, and we accelerate the process with certain chemicals. And you brought up the antibiotics, so I went ahead and here we go. Here's a systematic review of fluor fluoroquinolone. Had to slow down to pronounce it. Actually, this anti-inflammatory ends with alone as well. Okay, connection. Okay, so if it ends with those letters, read the fine print. This is by Stevenson, Wu, Cortez, and Rochon, I would say, and they go over exactly again a meta-analysis. So they look at the relevant studies, and the results were uh, very I would say positive in a scientific way that there's a very large connection between these antibiotics and tendon rupture. Now you go in, you go to your doctor and you're like, well, I need an antibiotic because I don't know. You got sepsis. Hey, how about that? You got a little bit of sepsis because of an infection. And they throw this nuclear bomb of an antibiotic at you. If you're Alex Smith and they say this is the one that's going to cure this, or else you lose your leg, you probably go with it. If you got a tummy ache and they give you this because they say it's bacterial, where's your risk reward there? Oh, I have a tummy ache. Can you give me some clindamycin or just some amoxicillin or something instead? Right? Those are relatively safe.
And anecdotally, when my son was young and he got a strep infection, and it looked like he had a golf ball lodged in the side of his neck because his lymph nodes became so inflamed. So, in order to knock it down quickly, they gave him an antibiotic shot at the doctor's office and then prescribed him a cycle of one of the more common antibiotics for that. Because, yeah, that's not good. So, we need to knock that down so it doesn't get worse.
hmm
Okay. But again, this isn't a let's just throw a chemical at it because I'm uncomfortable.
hmm But I mean, it's yeah, and we have to. It sucks that we have to be so educated as a population on these specifics. I know this about that antibiotic, and I went down this road of questioning everything because I took the antibiotic the doctor gave me, and he gave me levofloxacin, which is a quinolone antibiotic. After he TMI here burst the cyst that was connected to not my very very private area on my backside, and it was about a week. It was a 2 week cycle of this antibiotic. And I was already on clindamycin from the Minute Clinic that I went to that got me the referral to that surgery center. And he said, "No, that's the wrong one. Here's take this." And I'm about a week and a half into that 2 week cycle, and I'm walking down the stairs, and I'm like, "Gosh, my joints hurt. My ankles hurt, my knees hurt, everything hurt, and it felt like muscular. It felt muscular or connective tissue, the soft tissue, not the bone itself, not the joint itself. And I was just like, because I do this for a living. You know when you're like your muscles are super 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 sore, and you move and you feel the tendons stretching. That's what it felt like in these areas. And there was a big packet sitting with the packaging that the antibiotic came in, and I just was sitting at the counter, bracing myself on the counter because it kind of hurt to stand, and I started reading it, and then I'm like, what is all this fine print? And right there on it was tendonitis, sometimes rupture, especially the Achilles, and I'm like, well, this is definitely tendonitis all over my body. And I was like, okay, so I started looking it up. That's not even the right antibiotic for what I had. The clindamycin
Oops.
was the right one. The Minute Clinic people got it right.
Oops.
Yeah. So, but I'm
I,
not giving you advice if you have a
mhm.
perianal abscess to take clindamycin. Take what your doctor gives you, but if he gives you one of these, say, do I need that? Because I've seen the side effects.
Yeah, especially if this, gets us back to where we started, especially if you have a a problem already like, hey doc, I ruptured my, I tore my pec off of my shoulder not that
Yeah,
long
yeah.
ago.
This
So
was already there.
do
My
you have
tattoo.
something that isn't so harsh on my connective tissue that will still work?
I think
Know
that's
that.
why I
So,
knew how it felt because I remember how it felt when it was regrafting to the bone.
mhm.
And it was a specific kind of pain. It wasn't like I said the muscle soreness, but it is a little bit more specific to that I don't know you can identify unless you've actually ruptured a tendon. And it is a very specific pain that it's a scary pain because you
Yeah.
feel unstable. But go ahead. Go ahead.
So let's use you as a hypothetical example because you've talked about it is so if you go into the doctor and you're obese, your joints hurt all the time, and oh yeah, by the way, I have a genetic heart condition. okay, Sam, we need to get your weight down quick or your heart's going to explode. I'm going to prescribe you this.
Hmm.
Here are the side effects. Here are the potential downsides. But
Well,
if we don't
while
get,
you're talking, I'm going to bring up one of the this is good in certain populations, you know.
Mhm.
Yeah.
But if we don't get your weight down quick and take the strain off of your body, you're going to have a cardiac event much sooner rather than later. So the potential side effects of this medicine are balanced out. There are no solutions, only trade-offs. Yeah, we have these potential side effects, but you have a more immediate concern. So we need to get your weight down into a healthy range and then start working on your lifestyle, start getting into healthier habits because of your underlying health condition.
Hmm. And so I'll bring up this is another meta analysis here. It- uh, uh, and this is in clinical nutrition, January 2025. Jamail Amati and colleagues. Jamil Amati. I think I got that pretty close. Jamil Amati and colleagues, uh, and in their summary of their article, several investigations have demonstrated that semaglutide-induced weight loss is linked to decrease in lean mass as well as fat mass. Okay, so that's the important part, right? But on the other hand, the ratio of lean mass to total body mass rises. So that's actually a good outcome. So if you lose 30% of your body weight, but 80% of it was fat and
Mm,
20% of it was lean mass, you actually still had a positive result if
yeah.
you were obese. Now, I'm going to go to the tab before it because you can see some of my search terms here. I was trying to find studies with semaglutide and lean mass in normal weight individuals. I went through pages and pages and pages and pages. They're not done.
Hmm.
They're not done. This one, obese individuals. This one, obese individuals on bone density, type 2 diabetics, actually, here. This one, lean mass. This supports the one I brought up to begin with because it's, again, obese individuals, but they lost a lot of weight, but the lean mass was at a better ratio at the end of the weight loss. Bone health, GLP-1, again, obese individuals, clinically obese individuals, type 2 diabetics. So that's just the definition of a receptor agonist, which I didn't bring up when I explained it. But yeah, there was nothing. Only on severely, not even just obese, morbidly obese individuals or those with type 2 diabetes, which is a special case because type 2 diabetics don't have that knob on the door I was talking about earlier.
Mm, hmm.
That's why they have type 2 diabetes because the knob on the door was used so much because of their high sugar intake all their life that it basically fell off.
Or like my grandma, you were born without it, and she took insulin injections
That's
her
type
whole
1.
life. Yeah, type slightly different, but
No,
similar
I don't, I hate that they're the
mechanism.
same, they have the same name.
Yeah, you've ranted about that before, that you think type 2 should be a whole separate
Yeah, because type
disease
2
or
is
condition.
insulin insensitivity, where type 1 is the inability to produce insulin.
Yeah, which is why she took insulin
Yeah.
shots her whole life,
Yeah.
or you know, uh, the bone
Well, did you know they have a type
density.
3 diabetes right now? They're
I
calling
had
it.
heard that, but I wasn't sure
You
what
know
it
what it is?
was. No.
No, Alzheimer's.
What?
Alzheimer's might be the brain version of diabetes.
That is so weird. Well, okay.
Of
There's
type
an
2
interesting
diabetes because
rabbit hole.
it's actually yeah, it's a breakdown of the ability to absorb the energy and it basically
Mhm.
as we know with blood sugar as it floats through the bloodstream it inflames the blood vessels and the blood vessels are
So,
constantly inflamed in the brain and then the mitochondria break down and all that
so
stuff.
is the
So
hypothesis that the type 2 diabetes or the obesity leads to this because of
we
the
see a
long-term
higher rate
strain?
of it. Yes.
So there you go. There is another trade-off. There's another downside to being obese is, hey, it's going to affect your brain too.
Hmm.
Um, so that's not good. It, the
Also a
bone
reason to
thing.
focus on good sleep too, because the things that clear that out are in the later stages of your sleep.
Mhm,
So if I only need 4 hours a night or whatever, then you're not getting to that clear out stage.
yeah. You when you were going through the studies there were you went through some lean mass loss, but then the more concerning one was the bone density loss. Um, because that's a little harder to get back. You
Hmm.
can, but you have to be very careful with it. And if you are talking about an older population, female population, populations that are more susceptible to low bone density in the first place, and if on top of that you have been obese for a long time, that needs to be addressed. And this is where we both get so infuriated with our entire medical system now. And you've pointed this out before, is that when you're going through med school, the smarter you are, the better you do, the more you're pushed into a specialization
Hmm.
when it should be the opposite. That we need our smartest doctors as our general practitioners.
Yeah, I'll give a good example of that with bone mass is I have a few geriatric, what do you call geriatric clients? I don't know if this is the politically correct term anymore, but more mature clients in their 70s and 80s. And one in particular had been having hip issues. And of course, we're addressing the skeletal muscle part of it where I'm at, but and working with her therapists to do so. But she was going to a rheumatologist and a bone expert at the same time. And what happened for about a year and a half is they were prescribing drugs to her that counteracted the drugs that they were prescribing, the other one was prescribing, because the arthritic prescription, the prescription for the rheumatoid arthritis in the hip caused an acidic, I'm trying to get it right here, an acidic environment around the bone, which was causing more bone loss. The drug that was, I might have this in reverse, the drug that was given for the bone loss was causing an inflamed environment around the joint, which arthritis, inflammation, they're exactly the same thing, just in the joint itself. So the bone doctor was making the arthritis work worse. The arthritis specialist was making the bone loss worse. And we had this back and forth of counteracting medications because they're walking through their profession like this with
Yeah.
blinders on. And so your weight loss expert, whether it's a PA and now their RNs are prescribing these things now, or your doctor, is only focused on how much weight you have. Oh, you're still obese because your BMI is 35. Here's your drug. Well, say you're a perimenopausal woman. You're getting into that stage in your life where you're going to have to really address bone mass. Now, I will say the bone mass loss, this one's a little muddy. To put a disclaimer on it is there's a huge correlation with muscle mass and bone mass because one of the biggest drivers, the two biggest drivers of bone density are gravity and the muscle contraction connected to the bones. So the actual muscle contraction just being there, just having a tension, a tonicity causes bone to remodel in that way. That's why people who hunch over a desk all day end up with the hunchback because the bone remodels to be strong in that position, which an arch is a very strong structural position, right? So just the act of the muscles pulling on the bone because they exist is one of the biggest drivers of bone mass. So there's a huge correlation between muscle mass and bone mass. So we don't know if the bone loss is actually due to the drug itself or just that loss of muscle mass. So I will put that disclaimer in there, but that's still a concern because I
A-
said you ended up with a net result that was better if you lost some muscle, but you lost a huge amount of fat. Well, but we still have to address the bone. So we need to. Oh, I have a study here in a second. I'll finish that statement after yours with this study. So I'll get it queued up.
well, and that's what I was getting at, is that we need those smart general practitioners who don't have that tunnel vision. Because if you're not a fitness professional or just a fitness dork, someone who spends a lot of time reading this kind of stuff on your own to try and be healthy, you're not going to know that, oh, these are the side effects, these are how I counter them. This is what I need to do in order to get myself healthy and fit, or find the kind of professional that can help me do this. You're going to need someone to tell you, okay, you know, these are the side effects. These are the things you need to watch out for. If you feel like this, if you notice this, you need to tell me. Once we go through this regimen of whatever it is, once we get you to this point, then you're going to need to start addressing these other things, either on your own or find, a trainer or some other health professional that can help you in this area so that we can counteract these downsides.
All right, you kind of cued this one right in with your statement on counteracting the effects of it. We brought up the tissue effects of the anti-inflammatory and the antibiotics. What I need to know is how much damage is done because tendons take a long time to develop. That's why strength athletes pop their tendons a lot of times because the strength goes faster than the connective tissue. So how much did you age in that time and how much time do I need to spend counteracting that? And anybody that comes to me with one of those things, I change their workout cycles to do more uh, uh, lean tissue development before I go back to strength. Uh, but with the semaglutide itself, I did have this queued up. It is a nice little study, and obviously Swedish here with Jensen and all et al. And agonist treatment or combination treatment, a secondary analysis of randomized clinical trial. So, does exercise alone, GLP-1s, treatment, or both treatments combined preserve clinically relevant site-specific bone material density during weight loss? So, they took exercise alone as one group. They did GLP-1s alone as one group, and then a combination of both as the third group. So you basically have a control with the exercise alone versus the receptor agonist versus the actual study group, which is the doing both at once. So they found with 195 adults, that probably gave a very statistically significant result. Uh, and this again with obesity, the individuals with obesity couldn't find anything on any normal weight people. The combination of exercise and GLP-1 preserved hip, spine, and forearm bone mineral density despite larger weight loss. So they actually lost more weight in the combined group, but they preserved their bone mass better in that combined group. Now, the GLP-1 alone treatment reduced hip and spine bone mineral density compared to the placebo or exercise. So just taking the drug, they did lose weight, but they also lost bone mass and in those three spots. So what's the significance here? Per this study, again, just one study, uh, they it supports the idea that you might lose bone mass if you just take this drug thinking to lose weight without any other intervention. But the silver lining is exercise mitigated, counteracted that effect enough so that they didn't lose anything compared to the controls. So that I think is very important, and I think doctors and clinicians are you know that commercial that you talked about with Serena Williams. They don't address that. It doesn't say this combined with a healthy lifestyle is going to do this, but it's this isn't my first rodeo. I have clients that have been taking this, and I have seen performance drops in them, even though they're losing weight and they should be doing better, as opposed to the ones that actually just stick to a really healthy eating lifestyle and lose all the weight. Those people tend to perform very, very, very well afterwards. Now, I will say one of the things that bothers me, and I had this heart to heart with one of my clients after they were on it for good 4 or 5 months. They lost a considerable amount of weight. It was like 50 pounds, 50, 60 pounds in those first few months. which I mean they were morbidly obese. So that again, I didn't fight it. I just said, talk to your doctor. Here's some concerns I have about it when you come in my room, and you work with me because I don't want to hurt you. But yeah, do what you think is right with your doctors, and I will work around the rest. At a certain point after the weight loss, even taking the drug still, this person plateaued. And in the initial stages of taking the drug, they're basically nauseous the whole time.
Mm,
What they don't tell you in the commercial is you feel nauseous the whole time you're on this drug, especially if you eat something that counteracts with the drug, like sugar. So if you're nauseous anytime you eat simple carbohydrates or drink alcohol, guess what? You're going to stop drinking alcohol and eating simple carbohydrates just because you're nauseous. But at a certain point, that went away. And this person was able to eat more of those things. And that's when they plateaued. So at the end of the day, I was like, realistically, at the end of the day, to keep this going, you have to do the things that the magic pill didn't account for, anyways, which is control your diet and exercise. So, what's the mechanism here? Are you just nauseous all the time, or is it this magic little thing in your bloodstream? Probably a little of both.
mm.
A lot of the weight loss was due to the fact that people stopped eating because they felt bad when they ate.
Imagine that.
Imagine that. But again, the silver lining is if you are a candidate for something like this, exercise. Exercise. And in fact, in a way that promotes bone mass, which is strength training. Don't be afraid of it. Get a good coach. If you live in my area, come get me. Or one of our trainers we're about to roll out here soon. We're expanding the business. So, yeah, find a professional that is educated on the health effects of strength training when it comes to bone mass and all of the other things other than just getting strong. And shoot, you're gold. Also, exit plan. How temporary is this for you? Are you 450 pounds and you're trying to get to 250? Well, when you get to 250, what's your exit plan? It's going to be hard, as we just pointed out earlier, because there's a rebound effect. Do you have a nutrition coach to help you? Do you have a support group? That's a great thing, just like AA
Yeah.
and all those. Do you have a support group that's not going to be your friends saying, hey, let's go to XYZ Mexican joint and eat 3 baskets of chips and 4 margaritas?
That is a very good point of because we've talked about that when we talk about mental health generally is that, the people who hold you accountable as well as helping you, that tandem that you need. Well, same thing here. That's just where the mental and the physical are coming together is in order to get the physical health, you need that mental health to navigate those ups and downs. And uh this is where this the systems that we have created are so infuriating to me, um, because the I would critique the people putting up some of these billboards and advertisements of, hey, are you a healthcare provider or are you a salesman? Make
Mm,
up your mind, because so much of the noise around health and fitness is because someone is trying to sell you something. You know, a an easy target that we rant about, smoothies.
mm.
They're healthy because they have all of these antioxidants and nutrients and also 900 grams of sugar. Okay, that's not healthy. Okay, stop that.
Again, target
Um,
population. I have a client that is 110 pounds and comes in and normal height, 110 pounds. She strength trains a little bit, with me. And then she's like, I'm going to get a smoothie on the way home. I don't say shit because she can
mhm,
handle it.
mhm.
She's 110 pounds, trying to put on a little muscle. A little sugar and protein on her way out the door is not going to hurt her.
Yeah.
But this client that was on the GLP-1s, had he not been on the drugs or whatever, the medication, if he's like, "Oh, I'm gonna go have a smoothie because it's healthy on my way home after we did our workout," I'd be like, "No, you got plenty of energy in your body. Give me some proteins and fats in there, and you let your body take care of the energy part. You don't need
Mhm.
all that sugar."
Yeah, that is, I don't remember who I heard first point this out of. There are three macronutrients. Your body can't make two of them. The third one it can. That's what the liver does, basically. Is it takes calories and it turns them into carbohydrate. It takes stuff and it turns them into carbohydrates in order to give your body energy.
That would be me, by the way. You don't know who to give a credit to. That's me telling you
Are you
that.
the one who first told me that?
Yes.
Who made that point? I was like, that's a good point. That is a good way
It's
to
probably like
explain
episode like 8 or
low
something.
carb diets.
It's way
Okay.
by yeah. No,
I knew I had heard it a long time ago, and I was like, oh yeah, I got to remember that to when I'm explaining, diet basics and macronutrients to people.
well,
Um,
an easier way to do it is you got protein, which is building block. You have fats, which are a building block, and then you have carbohydrates, which are just energy. They're just energy. You can make energy out of the building blocks if your body breaks it down, but you can't make a building block out of the carbohydrate.
mhm.
So, I mean, I guess you can make fat out of it, but when you make fat out of a carbohydrate to store in your body, it is not a building block anymore, except for
Yeah.
that, except for a gas tank, is what it is. That's what the fat on your body is. It's a gas tank. We're reverse in Western society from how we evolved. We evolved to gain a whole lot of weight over the summer and then starve during the winter.
Mhm.
We do it the other way around. We got Thanksgiving, we have Christmas, we have New Year's, and we gain the
Yeah.
holiday pounds, and then we try to take it off for the summer, which throws off our vitamin D, by the way, because you store vitamin D in fat. So if you get fat during the summer, you get less sick during the winter. Not professional advice, but it's true. It's so we're actually reverse engineered in Western society because I'm in a room with air conditioning and
And
I have a
unnatural light
I have a
and
refrigerator where I have food
yeah.
at all times of day, even if I look in there and say I don't want any of this and I go to Taco Bell, it's still available to us.
Mhm.
So yeah, we're reverse engineering everything, which is kind of why we're all screwed up. But
On the plus side, since we were trying to end on a happy note, it
I
at
don't care if
least
we end on a
now,
happy note.
it,
Maybe somebody will say, "Oh, get mad and like go work out or something."
there is an upside to these drugs when you look at the significant health effects of being obese. As we started off talking about, it's bad,
Hmm.
and
Well,
we
I would
have
even
had an
say
incredible,
specifically to diabetes too.
yes.
If you're type 2 diabetic already, yeah, there you had some agency at some point in time, but look at the world we live in.
Hmm.
It is designed, I mean, just like doom scrolling and stuff. Get on your phone to check an email, and then 45 minutes later, you're still scrolling, and you're like, what the heck just happened?
Yes.
Because it's designed to do that. The billboards, not the ones we showed you, but the billboards for food and for libations and everything are designed to stimulate the hedonic treadmill in your head that says, I just ate, but I saw that ad with that thing I like and now I'm hungry. They're designed to do that. So if you're just now coming across this kind of stuff, if you're just now looking into being healthy, your type 2 diabetes is only partly your fault. You had some agency at some point, but how were you fed as a kid? How much did you fall into advertising? How much did you just not know that you were doing damage to your
Hmm.
body at some point?
And the good news is it is fixable. And now, as much we started out crapping on big pharma and their magic shot, but now
But that
there
got me
also
a
may be a way to jumpstart it,
hmm.
but make sure you're not just looking for a magic pill. That is an element of an overall healthier lifestyle and getting into good habits and getting rid of your bad habits as best you can.
Well, I am looking to see if we've got any studies on whether GLP-1s have actually reversed type 2 diabetes in individuals.
Hmm?
And I'm not finding anything with an initial search. It seems like it just alleviates the symptoms while you're on it. But I would like to see if maybe there has been a reverse effect, it might be too
Be
soon
awesome.
to know.
Yeah.
Yeah, it might be too soon to know.
All right. Well, that's all I've got for this little ranty health and fitness episode.
No, I think we covered a lot of good ground. If you're normal weight, gosh, please just be a little disciplined and do the diet exercise part. I know it's hard. I mean, I struggle with it. I have my when you come down, we didn't do it the last time.
Yeah.
We didn't do our Taco Bell trip the last time. Normally we were out fishing or whatever and we're like, "Ah, I don't feel like cooking when I get home, so we'll stop by Taco Bell on the way in." Kind of become a tradition. We didn't do it this last time. So that's good. Uh but we understand that's the reason I named my business Real Fitness. It's not because I really know more than everybody else about fitness. I know a lot and I have a lot of experience, but I named it that because I'm a real person too. I did a little workout before we did this, little workout. It was a pretty good one. I did a workout before we did this, but when I get on that rower to warm up, which is kind of my standard, I have to say, get on there. You got to do this. Part of your job. It's part of being healthy. Get going, just like everyone else. I'm not one of these, I'm so addicted to it, I have to work out every day. No, because I'm a real person. I get up in the morning and go, oh, I got to start work. Let me brush my teeth, get a cup of coffee. Everything will be better after that. Just like everyone else. Just like everyone else. And I also have the same temptations. I love potato chips. I love French fries. I'm not a big sweets person, so I have that going for me, but you give me a salty, crunchy snack and that bag is gone. That bag is empty. You've seen me munch down on the chips. So I have to take the steps that us normal people have to do to just make sure it's not always in my life. Uh, you, and I understand it with sugar addiction is so bad. I think it's worse than alcohol addiction for people. And I've got clients that say I passed by a cupcake on the counter, and not only did I eat the cupcake, I searched the cupboard for everything sweet after that and ate it all. After like weeks of doing well. After weeks of doing well, someone
Mhm.
like their son left a cupcake on the counter or something, and it was on. And I'm just like, okay, let's take a step back, get through it. I had my Oreo intervals. When I was addicted to Oreos way back in the day, I would say, okay, I'm going to get on my exercise bike. I'm going to do a Tabata protocol, and then I can have my Oreos. And I would go into a freaking coma eating those Oreos. And I would wake up with an empty sack and a half a glass of milk that had been dunked the whole time. Yeah, food is addictive. We get it. We're in real life. Let's take the steps to do it. Don't rely on a magic drug. If you are in that situation, use it as a tool. After you screw the light socket in with the screwdriver, or the light switch in with the screwdriver. You wouldn't screw the light bulb in with the screwdriver. But after you screw the screw in with the screwdriver, you don't just start hitting the wall with the screwdriver. You put it in the tool belt and you make sure it's back in its spot till you see another screw. Same thing with any drug you take. We shouldn't be marketing these drugs for a lifetime of being on it, which is what happens. And again, that's not your fault. That's not your fault. That's the company that's doing it trying to maximize their profits fault.
Yep. All right. Well, we will see you next time where we will rant a little bit more about relationships and how Hollywood doesn't know what they are.
Yeah. Oh, I thought I had finished Witcher for everybody, but they did a full length feature film to follow up the season 4. So I did finish that now. And you know what? That was actually better than season 4.
Mm.
The follow up to season 4 was better than season. It had Dolph Lundgren as a Witcher in it, which of course you don't ever expect good acting from
Don't care.
yeah, from him, but he's kind of funny because he's like so serious but funny at the same time. And there was actually a training sequence in that I was kind of like, this almost has some 80s nostalgia to it. So that little feature film was still bad, but it was better than season four. So you could actually recap season four by just watching that little feature film at the end. It's like Serenity for Firefly. You can watch Serenity on its own and you still get everything. Yeah, kind of like that.
Well, we may go into that awfulness when we're done ranting about Stranger Things. But all right, we will see you Saturday for some Stranger Things and Wheel of Time comparisons and ranting.
All right. See you then, everyone.